moms and dads. Welcome to today's Ask the Expert session with Dr. Ninia Rodil. She is a member of the Philippine Dental Association, the Cavite Dental Society, and the Muntinlupa Dental Group. And you can visit her at DentalFocus, where you might just see some familiar, famous faces as she is dentist to the stars. So welcome, Dr. Ninia.
Thank you so much, and hello to the dads and to the moms who are watching right now.
And today we're going to talk about oral care for toddlers and babies. But before we go to your questions, we would like to ask Dr. Nina, what is the most common concern that parents bring to you at your dental office?
Well, the most common concern that I encountered, the parents fail to bring the kids to the dentist as early as they can. So they start bringing them to us when there's a problem already.
Okay, so moms, please bring your kids early to the dental office so they won't get traumatized when things are already so painful. And as we go there, actually one of the questions from one of our moms is, so we'll talk about baby dental care first. When should they bring the baby to the dental office?
When they see the first tooth erupts, they have to bring the dentist there. But before the eruption, they should clean the mouth, the gums, and the tongue by using the squeeze cloth with water.
Actually, we have a question from Mommy Roseanne. They actually use cotton cloth or lampin in the Philippines to clean the baby's tongue, soaking it first in lukewarm water. Is this correct?
Yeah, that's very correct. We have to clean the teeth, the gums, and the tongue to remove the milk residue.
Okay. So our next question is actually a very common one. It's a common concern among parents. From Daddy Jan, will using a teether make my child's teeth crooked? And from another Mommy Arya, is it bad to use a pacifier or to let my child continue sucking his thumb in terms of the development and growth of his teeth?
Yeah, teether, it has nothing to do with the eruption, it's genetics.
Oh.
So whether you use teether or not, if the family has that problem, the child might have the same problem. Pacifier, yes, orthodontically speaking, it can cause crooked tooth or malalignment, and yeah.
How about thumb sucking?
Thumb sucking is also will cause problem later on.
Oh, okay, so let's try.
So we have to be very careful with the habits of our children.
Yes. Okay. This question is from Mommy Mia. When can I expect my child's first tooth to come in? And in the same vein, when do we expect the eruption of the milk teeth to be completed?
Well, eruption, you should expect the first tooth to erupt between 4 and 6 months. And it should be completed by the age of 2.
We move on to toddler tooth care. So this question is from Mommy Bianca. What food do we need to feed our toddler for stronger teeth and better dental health?
Well, mommy and dads, we have to give them a well-balanced diet, avoid junk food and food that are sweet. Give them vitamin A to maintain salivary flow, vitamin B to prevent canker sores, vitamin C to prevent gum inflammation, and vitamin D for better absorption of calcium.
Oh,
that's important.
We have a question from Daddy John. Is being prone to cavity something that's genetic, and are there preventive measures we can take so that our toddlers actually do prevent cavities?
Daddy John, yes, it's genetics. We get the size, the form, and the strength of our teeth from our parents and from our foreparents. And the next question is prevention. We have to teach them how to brush properly, how to floss, and visit the dentists regularly.
Yes. Our next question is from Mommy Kalay. Is it okay to brush an 18-month-old's teeth with regular toothpaste, or I suppose adult toothpaste? And another question we actually got a lot was, should we use toothpaste with fluoride or without?
Well, in my practice, I don't recommend regular toothpaste for an 18-month-old child. You have to give them non-fluoridated or toothpaste without fluoride unless your area has the water in your area has a low fluoride content. That's when you give them toothpaste with fluoride, but make sure that the child doesn't swallow the toothpaste. You have to give him at least just as small as a grain of rice or the pea-size shape.
So don't fill the toothbrush with so much toothpaste, moms. We have a question from Mommy Gemma. She's asking, isn't calcium essential for children's teeth and making them strong? But how come when they get too much milk, their teeth become rotten?
Well, there are two answers to the question. First, calcium is very important because it strengthens the body and the teeth. And second, it's not about the calcium. It's about the sugar that stays in the mouth after drinking the milk. So you have to feed or to give them water to drink after giving them milk to wash the sugar that's there.
We have a question from Mommy Karen. Oh no, her child grinds his teeth. What can we do to stop this?
Well, Mommy Karen, you have to see a dental specialist for us to know what appliance is best for your child.
Okay, we have time for one last question. This one's from Mommy Mia. Why do I have to worry about cleaning my child's baby teeth if they're going to fall out anyway?
Well, Mommy Mia, the primary or the milk teeth guide the eruption of the permanent teeth. And if you ignore the primary teeth, it might cause meningitis.
So please take care of your children's teeth. That's pretty shocking.
Yeah, that's true.
Okay, so that ends our session with Dr. Ninia for toddler and baby tooth care. We would like to thank you for joining us
Pleasure is
today.
mine. Thank you also so much for your questions.
And we hope you guys enjoy today's sessions. And if you have any questions or any comments, just type them down here somewhere there. All right. Thank you, moms and dads.